guys, my name is Ria Michelle, and welcome to yet another.
She's the baddest boo with the natural do. She's taking the talents to the new YouTube. If you like her style, please don't bite. Give it a thumbs up, comment, and please subscribe.
Hey guys, my name is Ria Michelle, and welcome to yet another beautiful day that God has blessed us with. Today I'm going to give you guys a little bit more of an update on my preceptorship. As you guys saw in the previous video I just posted, I finished my preceptorship, and now I've got more tips that I can give you guys and things that I've learned along the way, because I will officially have my patient load on my own next week. So have a list of things that I got for you that I was able to take note on as I went along, and we're going to go ahead and get started. So one thing that I really realized as I went along the whole preceptorship, which lasted 6 weeks, was making sure that I can manage my time. I still am working on that because it is a lot. You have to know who to prioritize, how to delegate, when to ask for help, and that is huge. Like, nursing involves teamwork 100%. Actually, I would like to say 110%. So you can't be afraid to ask for help, and don't wait until you're completely overwhelmed to ask for help, because then it just becomes more stressful for not just you but the other person. I would just say to know when you need help and say, you know what, like, I feel like I'm about to start drowning in the work that I have, and I need to go ahead and do what I gotta do. So if you see somebody who may, even if they just pass by and say, hey, like, do you need any help? Like, I'm all caught up. Please just don't be afraid to say, you know what, yes, please help me out with this. I need to give medications to this patient, or I need to get this patient started for discharge. Can you please discontinue their IV? Whatever you need done, just don't be afraid to ask. The other thing with time management is grouping your care. I was having trouble because I feel like most nurses, if not all, have this trouble where they see that there's medications to be given, or I don't know, if like you need to do your assessments or whatever in the morning, and you may go get the medication and then be like, okay, well, I'm going to go back and I'm going to do the assessment later after I give all my morning medications. And that's not something that is really productive when you think about it in the long run. People think like, oh, I have 12 and a half hours to do everything that I need to do for all these patients. But like, if you really sit down and think about it, I have a total of 6 patients. That means I only have 2 hours per patient. And if you think about all the other like interruptions that happen during the day, if they get taken down for a procedure, or if, say, the patient is sleeping, you know, not every patient is going to be wide awake at 7 o'clock in the morning, especially for you night shift people. They're not going to be wide awake all night for every single patient. So if you think about all that and like take that into account for the time, you really only have like an hour for each patient, if you really think about it. And that's not a lot of time to provide a whole day's worth of care. Think about all the stuff that you do yourself during the day. You gotta get up, you gotta brush your teeth, you gotta get dressed, get freshened up, you know, if you take a bath or take a shower, get ready for the day. That alone usually takes people 30 minutes to an hour. Us females, maybe even longer, you know? If you think about someone who's critically ill and they aren't able to get up and move around, that's going to take even more time. So just take that into consideration when it comes to your time management. I would suggest that you guys group all of your morning and afternoon meds, or for your night shift people, whatever, like how you group your medications, like the beginning of your shift even towards the end of your shift. And then what I personally do is I go in and I greet the patient during report, because we have to do bedside shift report. During that time, I'm able to at least like introduce myself to the patient, get an eye on them, and like do like a really quick visual assessment. All right, do they have fluids running? You know, do they seem like they're short of breath? Do they have oxygen? You know, do they have any wounds that are visible from their arms? You know, if they're like not covered up in the bed completely. So that's like my first little tiny assessment. And then I make sure that I can go to the computer and look a little bit more up about the patient, because obviously you have to go in there to look up their medications that they need anyway, and see if they have any like labs due or procedures that they have going on. And I'll get all their medications, and then I'll go back into the room. Let me just back it up a little bit. When I say their morning medications, I'm getting their, if they have like an 8:30 a.m. medication and a 10 a.m. medication, I'm gonna grab all of those medications. And with that, our hospital in particular has like a rule that you can give a medication an hour before or an hour after. Nothing like that's too much earlier or too much later. So the way that I handle that is if I have an 8:30 a.m. medication and a 10 a.m. medication, then I can give them at 9 o'clock and it'll be no problem. So I'll make sure I do that. And when I'm giving the medication to the patient, I found that my flow is like nice whenever I give that to them, or right before I give them the medication, I'll do my full assessment. When I say full assessment, I do not mean the one that you're taught in nursing school. That's going to take way too long, and you don't have that much time to be able to do like a full head to toe assessment on every patient. You're going to be able to do head to toe, but a truncated version. So instead, you're going to take a look at their eyes. Are there any abnormal eye problems? Like, are they blind? Are they experiencing any conjunctivitis? You're going to see that. Like, as far as shining the light in their eye every day, that may not always be something that you can do. Do they wear a hearing aid? If so, make sure you take a note of that. That's some of the hearing things that you can do. If they have like anything on their face or their scalp, you can see that from your visual assessment. You don't always have to like touch them to do that. Now, if you notice that their diagnosis is maybe they have like some sort of like issue that is underneath their hair, like maybe they fell and hit their head, and say like it's on the back of their head and they got stitches in the ER, but they're coming in for like an overnight stay, and they have really long hair that may flip over the part that they shaved to do the staples. You're going to have to actually like touch them. That's like one of the examples where I would say go ahead, feel free, and grab some gloves so that you can actually feel in that area. Make sure it's not swollen or there's no exudate coming out of there. You have to make sure you do that. Use your best judgment, because you are a nurse now and you can do that. And then I always listen to the heart and lungs. Always. I always check their skin, front and back. Don't be afraid to flip your patients over. If you need help turning a patient, ask for that help. And I always make sure that their extremities are not edematous and they're not experiencing any pain. Always ask your patients if they have any pain or discomfort, because then that's going to let you know if they are, where to focus on your assessment. If they have like a certain diagnosis, make sure you spend more time in that area. So if they have like atrial fibrillation, make sure you listen to their heart. See if they have any trouble with shortness of breath, or if they're feeling dizzy or anything, especially when they're changing positions. That's all going to be based on your judgment and your clinical knowledge. And this is stuff that you can take from nursing school as well. So that's what I'm saying about the assessments. Like, it's not going to be these like 20-minute assessments or 15-minute assessments that you did in nursing school that were like super, super thorough. And another thing I wanted to point out was when you have your schedule, like, it's not that bad when you have to work back-to-back days. At my facility, if you worked one day and you have like a consecutive day or days, because some people like to do their 3 in a row, then they're trying to make sure you have the same patient load and patient assignment as you did the day before. So that makes it easier because you already know your patients, you already know what to expect as far as procedures and their diagnoses and the different medications that they'll need and the care that they'll need, and you'll be able to work faster throughout your day because you pretty much know what their baseline condition is, and if there's any changes, you'll already be able to pick up on that right away. It also makes your report handoff easier because if you have the same day or night shift nurse that you'll be reporting to, then they'll already know the patient. You'll just say, hey, these are the updates that I have for you. The patient desatted a little bit earlier today and we had to give them this medication to get them back to their baseline. It'll be just quick, just like that. So if you are planning on working back-to-back days, that's something that is a benefit for that. And with that, I did also want to say with time management to try to document on your patients early if you are able to sit down and I shouldn't even say sit down because a lot of us we will stand throughout the entire day most times, but once you give off your morning medications, say you have all medications and the last morning med you have to give is like 10 a.m. And we're not talking about like insulin or anything like that. We're just talking about like all the different medications you give for the morning time. And then you have all of your patients medicated, everybody's comfortable, everybody is situated how they need to be. Take the time that you have in between, like 10 a.m. to 11:30, or whatever the allotment time you guys have for your insulin protocol, and use that time to document. Yes, you probably will have some call-outs that you have to respond to. Yes, there may be family members who have questions and they may be coming in around that time, but try to use that time to document as much as you can. My preceptor recommended that I have at least 2 patients documented on by the time I go to my lunch break. That way, I don't have too many by the end of the day. I'll have 3 to 4 that I'll have to document on, and that doesn't take that long. If you already know what you're looking for and the things that you need to document on, then it's not going to take like hours for you to do your documentation. You can just go right through it, put all the things that may be abnormalities or the changes in the patient's conditions, and then you'll be done. Usually for me, it takes me about, for 4 patients, I would say it takes me about an hour to do the documentation on. And I feel like if by the time 5 o'clock rolls around, if I have that other like afternoon break, if you'd like to call it, where I've given all the afternoon meds and I just have that time, then I'm just going to use that time to do my documentation. That way I can give my shift report and I can be out by 7:30, 7:45. That's what my goal is going to be as I go forward with my own independent patient load. So I'll keep you guys updated on that and see how that goes. Because so far, like, I'm not gonna lie, I have been leaving at 8, 8:15, sometimes even 8:30, because I'm still getting into my flow. I'm still trying to figure things out. The other thing with that is I do have to say, even if you feel like you're on a roll and you're just getting all of your stuff done, you feel like it's so busy, it's just too overwhelming for you to stop and take your lunch break, you need to take a break. Like, it has to happen. Even if you take just a few minutes or 10 minutes or something to get something into your body needs to A, refuel. B, you need to do like almost like a little hard reset on your brain to allow your brain to just take a step back for a minute from all the things that are going on and all the organized chaos that's going on, and sit back so you can really gather your thoughts and make sure you can still critically think throughout the rest of the day. Because if you don't give yourself a break, you're not going to be able to do all the things that you normally would, and you're more prone to making mistakes. So you don't want that. I also want you guys to know that at first you'll feel like you're just finishing different tasks and making sure you have your patients medicated, making sure that everybody is alive, and making sure that everybody has their questions answered so that you can just check all your boxes, as my director has said. But eventually, over time, you're going to see that, all right, you've gotten into the groove of things, you feel more comfortable with all the work that you're doing and with your role. So now you're going to be sitting there and saying, okay, I've done all the things that I normally would need to do. But I did notice that so-and-so was coughing a lot. And normally they haven't had a cough. I wonder if when they were drinking their orange juice this morning with breakfast, if they aspirated. And then you're going to be able to start really critically thinking and putting the pieces together that you learned in nursing school on what you should do next as a clinical professional. So then you would say, okay, if they're laying flat, let me lift their head up, and then let me listen to their lung sounds. And if you hear any abnormalities, we need to contact the doctor so we can see what we can do from there so their condition does not worsen into getting pneumonia or something like that. So right now you may feel like, okay, like I'm not comfortable with that just yet. And honestly, I'm not fully comfortable with everything. And it may take a while. You know, some nurses say that it takes a whole year. Some say it takes a little bit longer, but you always, always, always will be learning. And if you feel stupid, if you feel like you are incapable of doing the things in your role because there's just so many things and so much information being thrown at you and you're overwhelmed, that is to be expected. Don't sit here and doubt yourself, because remember, you made it through nursing school and you were able to graduate, walk across that stage, or for those of us who graduated during the pandemic, you're able to virtually graduate and get your degree and pass the NCLEX. That was hard. Remember how hard that was. And you made a lot of sacrifices to get to the point that you're at now. You got a job. Obviously, your employers see that you have that spark and you have the ability to do well in your position. Don't doubt yourself. Continue going forward. Take all the information. And I would say don't be afraid to ask questions, because you're going to have a lot of questions in the beginning, and it's okay. You're always going to have questions. That's just how it is. Nursing as a profession, healthcare as a profession, is one of those careers where things are always changing and evolving, and you're going to have to learn all the time. So it's okay if you feel that way, but don't doubt yourself. Don't feed into that and say, well, I am stupid, so I can't do it. You can do it. Another thing is, even if you do make mistakes, please try not to dwell on them too much. Know that you are, and you always should put your best foot forward. Do all the things that you can do to provide the best possible care to all of your patients. If you know that something's going to be negligent, don't do it. If you feel it in your gut that something's going to be dangerous, don't do it. Go ask your supervisor or whoever is more experienced, and make sure that you're comfortable with the answer and you're comfortable with what you're doing. If you don't feel comfortable with what you're doing, then it's something that you need to pause for a second and try to figure out what you should be doing instead. So something that's really helpful that I'm going to be able to get to do is that my facility is having me start out my first official day where I would have my own patient load. I'm only going to be working for 8 hours. And what they want me to do is the admissions and discharges, because it typically gets super, super busy. And you guys know it's really busy now. And a lot of people are coming into the hospital, so something that's going to help me with time management and with really like getting comfortable with gathering patient data and information is doing all the admissions and discharges, because then with the admissions I'm able to sit there and do like a full assessment and evaluation of the patient. And we already know that those are very time consuming, so that's going to help all the nurses who are doing their regular patient load day. And doing the discharges is also helpful because I was able to discharge a few patients during my preceptorship, but I still feel like, it'd be nice to just do it on my own so I can do the whole thing through. I can discontinue their IV or their port. I can make sure that they have a family member or a friend who's going to come pick them up, or an ambulance service, and then I can make sure all of the stuff is taken care of. Like, one thing I really wanted to practice was discharging a patient or getting them ready to be transferred to a SNF, which is a skilled nursing facility, or ALF, which is an assisted living facility. That you have to do like a really good assessment on the patient to make sure that everything's okay with them, so they'll be able to be moved over there without any pressure injuries that were unreported or any medical conditions that were unreported. So that I'm hopefully going to be able to get that experience in that 8-hour shift that I'll be doing next week. But I feel like if you are able to do that at your facility, or at least to come in and help out with some of the places where things fall short, not actually have like your own dedicated patient, but just kind of be like around so that people can get your help with whatever clinical stuff they need. That will help build your skill set, and it'll help you feel more comfortable when you are on your own with your own patient load. So as far as that, those are the things that I have for your time management.